Hello everyone, this is Parveen Sandhu, Assistant Professor at RPIIT College, Bastada, Karnal. Today I am here to discuss a topic, routes of drug administration. What are the routes for the drug administration? Most drug can be administered by a variety of routes. The choice of appropriate route in a given situation depend upon both on drug as well as patient-related factor. Routes can be broadly divided into two action. These are local action, systemic action. Factor governing choice of routes: physical and chemical property of drug such as solid, gas, liquid, solubility, pH, irritancy. Site of for desired action such as localized and approachable or generalized and not approachable. Rate and extent of absorption of drug from the different routes. Next one is effect of digestive juice and first pass metabolism on the drug. Next one is rapidity with which the response is desired, routine treatment or emergency. Next one is accuracy of dose required. Next one is condition of the patient such as unconscious or vomiting. Local action or local route. These routes can be used for localization at accessible site and for drug whose systemic absorption from these site is minimal or absent. Thus, high concentration are attained at the desired site without exposing the rest of the body. The local action or route are of three types, which are topical, deeper tissue, or arterial supply. First one is topical. This site refers to external application of the drug to the surface for localized action. It is often more convenient as well as encouraging to the patient. Drug can be efficiently delivered to the localized lesions on skin, oropharyngeal, eyes, ear, canal, anal, canal or vaginal in the form of lotions, ointments, cream, powders, paints, drops, spray, lozenges and sports trees. Deeper tissue, certain deep area can be approached by using syringe and needle, but the drug should be in such a form that systemic absorption is slow. Example, intra-articular injection such as hydrocortisone assisted in knee joints, infiltration around a nerve or intra-ethical injection such as lidocaine, retrobular injection, hydrocortisone assisted behind the eyeball. Arterial supply. Closed intra-arterial injection is used for contrast media in angiography. Anti-cancer drug can be infused in femoral or brachial artery to localize the effect for limb and malignancies. Thank you for watching my video. Please like and subscribe our RPIIT channel. Thank you.